hearing any sound.
Amy, would you like us to just get started?
Yeah, I think so.
Ready to go? Okay, perfect. Thanks everybody for being at the training today. My name is Katie Lindstrom. I'm the director at the Pacific County Health Department, and co-presenting with me today is Stephanie Michael, and she's our health programs manager. Uh-oh, I'm getting echoey. Hold on one second here. Okay, sorry about that. So we are streaming live on YouTube.
Ocean Beach staff, you need to mute. Not all of you are muted.
Okay, technical difficulties. Hopefully that'll be the last of them. The reason I was getting feedback is because we are recording this on YouTube just for any staff who may not be able to be here today, or people who get hired throughout the year, so they can go back and review the safety training later at a later date. Again, my name is Katie Lindstrom. I'm the director, and Stephanie Michael, who is our health programs manager, and also our lead on the COVID response, is also co-presenting. So we just have, I don't know, about an hour long or so presentation just to go over the required health and safety components that the state has put into place because you guys are looking at going back to in-person instruction. So we just kind of wanted to go over the different requirements and then give you guys a chance to ask questions. So feel free, if something comes up as we're going, just pop in with a question, raise your hand, put it in the chat, or just unmute yourself. We'll also save some time at the end for questions for anything that isn't covered during the presentation as well. So if Stephanie, if you want to go to the next slide. Okay, you probably have seen this at least in some variation, but the state put out a decision tree and guidance that schools are supposed to use to determine whether or not to open up to in-person instruction fully, partially, or staying in an online learning model. And these are the guidelines that the county uses to make a recommendation to the school districts. Ultimately, opening and to what degree is up to the school boards. I do understand you guys are looking at opening up at least partially here within the next couple weeks. And so wanted to just go over and share with you what goes into that recommendation and decision. The next slide. So basically counties fall into one of three risk categories. There's low risk, moderate risk, and high risk. And that's defined based on the case rate per 100,000 over 14 days in the county. So if we have an average of 25 cases per 100,000 over the last 14 days, we'd be considered low risk. 25 to 75 cases is moderate risk, and then greater than 75 cases is high risk. So back in August, when we made our first decision or our first recommendation to the schools, the county had been in the high risk category for several weeks. What we were waiting for was at least 3 weeks of being in the moderate or low risk category before we changed that recommendation. So I should back up. So based on the high risk category that we were in back in August, the recommendation you can see as you go down the chart is a strong recommendation for distance learning when we're in the high risk category. And so that's why our initial recommendation to the school district was to start remotely. Once you're in the moderate risk, that's when the recommendation changes to starting to do some in-person schooling for elementary students, and then over time rolling the middle and high school students in. Once you get into the low risk category, it opens up even a little bit more and to having middle, high school, and elementary all back in person, at least to some degree. But of course, also remembering that all of the health and safety guidelines need to be following. Specifically, the spacing, the 6-foot spacing is required. So that kind of limits how much a school can go back in person because that 6-foot requirement is there regardless of which risk category county falls into. All right, so initially we had done the high risk recommendation, which was all remote learning. Over the course of the end of August, beginning parts of September, we moved into the moderate risk category. And then now, Stephanie, jump in. Are we in the low risk or did we pop back up into moderate?
We are still in low risk at about 13.9 cases per 100,000 per 14-day rolling average. So that's what we are in Again, we just added 2 probables yesterday, and we expect to get some out of the outbreak that's happened at Pacific Seafoods across the water in Warrenton. So we'll kind of see how that changes over the next couple days.
Yeah, and as you can see, the situation changes. It can change by the hour. We can think things are great, and then 5 cases roll in at 4 o'clock at the end of the day, and everything changes, and then those cases turn into 5 more because of contacts. So things really can change quickly, and because of that, what we're looking at when we're making our recommendations is staying in a risk category for at least a 3-week period before we make any recommendations, because we're trying to avoid a yo-yo of, okay, school's good, go back, and then, oh, no, school's canceled, the data got worse again. So we're not looking at like day-to-day blips in data. We're looking at trends of at least 3-week periods moving between these categories before we make recommendations. So that all said, we were in that moderate risk category for a significant amount of time, and it was enough for our health officer to feel comfortable to recommend a return kind of in that yellow category. And that is what most of the schools in Pacific County are going to go ahead and follow through on, is bringing back elementary as space allows within the building. So kind of based on square footage, and then over time rolling in those middle and high school students, assuming things continue to go well. So next slide. So once you're in whatever category you're in, and you're going to move forward with some in-person schooling, you have to complete 2 more steps. And those 2 next steps are really around ensuring health and safety policies and procedures are in place. And then the 3rd step is around being ready in case there's an outbreak. So the requirements for step 2 in terms of the health and safety requirements are having procedures in place to protect students and staff who are at high risk, and making sure they still have access to learning if they can't be on site. Having policies and procedures around transportation and drop off to minimize the amount of contact between students and families. Being able to group and cohort students, especially elementary, to minimize the number of close contacts. So just having small groups of students who kind of stay together all day. Being able to practice physical distancing. And I saw in the chat, somebody had asked the 6-foot rule, and it is 6 foot. Actually, I think Amy has here, it's a 6-foot radius. Stephanie, I thought my understanding was it was desk to desk. You have that?
Yeah, I thought it was from the student.
Okay, so it's a radius then,
Yeah.
6-foot radius. So being able to promote frequent hand washing, and then ensuring, this is a big one, ensuring everybody is wearing face coverings all the time, really with almost no exceptions. And then of course, having improved ventilation. And that can mean a couple different things. We'll go over that in more detail in later slides here. So go ahead to the next slide. Once you've identified that you're able to do all of the health and safety standards in step 2, then you go to step 3, and the school needs to kind of certify and be ready to handle a potential outbreak. And this is kind of the school district plus the county capacity to handle an outbreak. So making sure that the school is able to monitor for symptoms every single day through either a parent attestation or on-site screening. Preparing, having plans in place in case kids or staff get sick on site, having letters ready in case there is a confirmed outbreak. And then the next 2 are kind of county capacity issues. So does the county health system have adequate testing to handle an outbreak? And also, are we able to handle the quarantine and isolation and contact tracing that would be required if an outbreak were to occur? So once all of those things are in place, you have all this health and safety stuff, you're in a moderate or a low risk, that's the point when you can actually move forward with some on-site learning. Next slide. In case you're interested in finding or calculating the data, you can do it the old-fashioned way, just with math. You take 100,000 divided by our population, it gives you the 4.53 multiplier. You add up all of the cases within the last 14 days and you multiply it by the multiplier. That gives you our case rate per 100,000 over 14 days. Or if you want to take a shortcut, you can go to the PacificCountyCovid19.com website If you scroll down, there's 2 data dashboards. The second data dashboard, you click on the Pacific County Risk Assessment and select Pacific County in the drop-down list, and it'll show you a trend slide like the one demonstrated here. It's a screenshot, I think this was from a few weeks ago, but it'll show you the trend data on our case rate. That orange dashed line there, that's 25 cases per 100,000. So you can see, I know it's kind of small, but you can see up until about July, we were down below that 25 case rate per 100,000. We took a big spike up in August, kind of came back down, bounced back up. You can see how we kind of go up and down because our numbers are small, but we're actually back down into that good category again, at least as of this moment. So next slide. This is just a kind of a nicer visual. It shows our trend data based on that low, moderate, and high risk category. And again, you can see over as of data of September 20th, we're down into that green low risk category. So we're very hopeful that that we stay there, or at the worst, maybe in the moderate. If we do end up getting back up into the high risk category and we stay there for, again, at least a 3-week period, that's when we would begin discussions around potentially dialing back some of the in-person instruction. Next slide. Actually, before I get to face coverings here, I see a question. What about the students who are in 2 cohorts, general ed and special ed? Yeah, and that's something that we know it won't be a perfect science to having kids only isolated to one group. We know there's situations like that. So I think it's just about kind of doing your best, limiting contact as much as you can, but we understand that there's going to be some circumstances where it's just not possible. Elementary school in general is going to be easier. Middle and high school, it starts to get pretty tricky with kids moving around in classes. So we would, recommend considering, limiting that kind of thing as much as possible. But there will be some risk probably built into decisions that are made. Okay, so this next section, the state does require that all students and staff are wearing face coverings at all times while at school. This is actually a requirement through L&I for all of you as employees. It's a requirement for the school district to provide a safe and healthy workplace. And part of that is ensuring that everyone's wearing a mask. It also comes down through OSPI that all of the students need to be wearing a mask. So the policy is obviously everyone has to wear a mask. Volunteers, staff, guests, students, teachers, parents, everyone needs to be wearing a cloth face mask. There could be some exceptions to the cloth face mask on a very limited case-by-case basis. And in that case, the student would wear a face shield, but it's definitely not preferred at all. The face shields are not as effective kind of in the entire effort. But those would be sort of case-by-case basis. If a student or a staff is unable to wear a mask completely or unwilling to wear a mask, that would probably be a point where you'd want to move that person to online learning only model. Please clarify, we will need. Yeah, so it says, please clarify, we will need to be in the high risk for a period of time before we go back to remote. Correct. Well, actually, I should back up. If there's an outbreak at school where there's students and staff, more than one probably at the Ocean Beach School District who test positive for COVID, that would be a situation where there could be an immediate shutdown of school for at least a few days to maybe up to a couple weeks, kind of depending on the circumstance. So that could definitely happen. But in terms of just looking at the countywide data, we would need to be in that high risk category for at least a 3-week period before I think we would be making recommendations to dial back online learning, because again, we're trying to avoid that yo-yo. It's already very disruptive to school, and we're trying to not be trying to minimize the amount of how disruptive things are in terms of our recommendations. So,
and Katie,
yeah, 3-week period.
Also to hinge off that, if there were like a major outbreak down, here in Long Beach, that would also trigger that, like what's happening in Warrenton, for example.
Yeah. Oh gosh, I hope something like that doesn't happen here. We're still kind of waiting to see. Some of those 77 are likely ours. We tend to usually have at least a percentage of those ones from Astoria. So we still haven't heard yet. We don't know for sure, but yes, Amy, if something like that happened in the community, that would be another potential reason if it was a really significant spike or a big outbreak. It's not a perfect science, but yeah, when I'm talking about the 3-week kind of curve, that's more about our general county data overall, that case rate per 100,000. There certainly could be other reasons to shut school down. So let's see, where were we at here? So the district should be providing face coverings to students who don't have one. And I think we've helped you guys get a whole bunch of masks, and I think you've bought some through ESD. So hopefully that's not an issue. And then if face masks and face shields both should be washed or sanitized between uses. That's pretty important. We don't want to carry germs from day to day. Next slide. If a student or a staff member does need to wear a face shield, again, limited case by case basis, the face shield has to be the kind that wraps around the face, goes down below the chin, should be worn with a cape that connects to the bottom of the face mask down to the shoulders, which sort of seals in that gap area. And it needs to not have a gap up at the top. So the kind of ones that are kind of sealed up at the top as well. Cloth face coverings, I don't know if this is going to apply to you guys, but children younger than 2, anyone deaf or hard of hearing, and then of course anyone who is incapacitated in such a way that they couldn't take their mask off on their own. Those would be actual exceptions that would be to the face masks. Let's see, face covering should be worn even when distancing is happening. So that's an important one to remember. The one exception is, and I think the schools are going to come up with this, is mask breaks could be allowed outside when students are far away from one another. And just kind of in the spirit of trying to increase compliance, that would be kind of a building by building decision on where and how those might occur. All right, so just a little bit on why of the face coverings. There's kind of 2 schools of thoughts of people out there with face coverings. There's a group of people, I think, who think that the face coverings are really about protecting the wearer, but that's really not the case. The face coverings are actually protecting people around you for the most part. There's some nominal protection by wearing the face mask from other people's germs, but for the most part, the face mask is designed to contain your droplets. So when you're speaking, when you're singing, when you're talking loud, definitely when you're sneezing or coughing, droplets are coming out. You don't see them necessarily, but they're out there. There's a little fog kind of around you, around about a 6-foot radius. If we wear our masks, those droplets stay in our mask, and therefore we're not going to be as likely to infect the people around us. And you can, and people do, infect other people when they are completely asymptomatic. So you could feel 100% fine and not know you are positive for COVID and infect other people. So that is the primary reason we wear masks. Masks that are designed to actually protect the wearer would be more like an N95 mask, and that's not recommended for the general public. Those are reserved for medical providers who are doing aerosolizing procedures where there's a significant risk to that person, and they're working on a person who is known to be sick or have an infectious disease. So the cloth masks are really designed to keep our germs to ourselves, and it works really well when we all wear our masks because now we're all keeping our germs to ourselves. So by kind of all doing it collectively, we're all protecting each other and ourselves. Do you want to start the video, Stephanie?
Well, last week, Washington State put a mask mandate in place requiring individuals to wear a face covering in indoor spaces and also requires face coverings outdoors when people can't stay 6 feet apart. The mandate is in place to prevent the spread of coronavirus. Well, there's still a lot we don't know about this virus. What we do know is that it spreads through droplets. So we wanted to know, how effective are masks when it comes to stopping them? Our Kevin Kim got an exclusive access to a lab in Spokane to test it out for himself. Full disclosure, this demonstration just looks at droplets, not specifically the coronavirus. But if you keep in mind how this virus spreads, the results may surprise you.
From blue polos to blue lab coats and gloves, we headed down to Sacred Heart's laboratory to unmask a common question. What exactly does a mask do? So we teamed up with the hospital's microbiology director, Dr. Rich Davis.
This one will be no mask. It's a demonstration of where respiratory droplets go and how easy they are to transmit and how a mask is effective at blocking those. That's really the key takeaway.
Here's how this demonstration worked. I had a petri dish in front of my face as if it's another person's face. Then, with and without a mask, I talked.
Hey, how you doing?
Sang.
Somebody once told me the world is gonna roll me.
Coughed. And sneezed. We also tried coughing with and without a mask from 2 feet away, 4 feet away, and 6 feet away. Dr. Davis put the dishes in an incubator, and we waited 24 hours for our results.
So these are the plates that you were interacting with yesterday, with or without a mask.
Let's start with the face-to-face demonstration. Mask on the left, no mask on the right. Let's go with talking first.
The mask? Oh, that looks good. Talking without a... Oh, okay. I'm actually shocked there's any at all. I'm gonna be completely honest with you.
Next up, singing.
This was Changes by Tupac, and this was Smash Mouth. Things will never be the same, never be the same, yeah.
Pretty similar to talking, but Dr. Davis brought up a good point about one of nightlife's most popular activities.
Like karaoke night, when that microphone after the night, I'm sure it's pretty gross and wet. So now we've got coughing. So this was just two coughs.
Really?
Ew.
That's crazy.
Remember, all those yellow dots, that's where bacteria grew after the droplets out of my mouth landed there. But those droplets were nothing compared to the ones from sneezing. First, mask on.
What? Okay, I'm terrified to look at this one. This is no mask. Ooh! Oh. Good Lord.
When I had my mask on, no yellow dots. But when I didn't, there was always something.
What this kind of goes to show is that most of those, heavy, fat droplets that are going to come out of your mouth, that are going to have bacteria, they're going to have viruses potentially, they're going to get caught and not go forward into, the space in front of you.
It was the same case for the social distancing demonstration.
So yesterday I was standing right here.
No mask, with a mask, 4 feet. You can see it's less, but still pretty prevalent. 6 feet.
Oh, okay.
Yeah, just one or two few up there. So there really is that distance difference where the droplets that you're producing by coughing are pretty much, a lot of them are falling out of the air. To me, I think we're coming into a new reality where masks fit into that very social conscious paradigm. You do simple things that everyone can do. It's not going to be 100% effective, but if we all do it, it's going to definitely make a difference in preventing things from spreading one person to another.
All right, thanks, Stephanie. If you can pull the presentation back up. Okay, so that was just kind of a good demonstration of how many of those droplets really do get stopped by wearing the masks, and also just with that distancing. So kind of a good demonstration on that. This here is another visual that shows the risk of spreading COVID based on different scenarios. Over on the left here is a person who is infected with COVID, and then on the right, the blue person is a healthy person. And then in the middle, it's talking about whether they're wearing masks or how much they're distancing. So you can see if both people are closer than 6 feet and neither person is wearing a mask, the risk of spreading COVID is very high. If only the healthy person is wearing a mask and the person who's infected is not wearing a mask, it's still a high risk. Once the person who's infected puts the mask on, the risk goes down to medium. If they're both wearing a mask, but they're still closer than 6 feet, it's a low risk. And then the best case scenario here is that both people are wearing masks, both people are 6 feet apart, and now we're in a very low risk category. And then of course, staying home is going to be virtually none. Let me take a second to look at these questions in the chat. What about cloth masks with vents? So we don't recommend those because they kind of are defeating that purpose of keeping your germs to yourself. The vents actually, out of the venting, will all the germs kind of go out. So we don't recommend the cloth masks with vents. Based on the video, how safe is it to stay in a classroom for several hours after students are unmasked for eating? What if they cough or sneeze while unmasked? What are your guidelines or recommendations? We actually have a video here that we're going to show in a few more slides that talk about the aerosolized droplets and how long they stay in the air. So I'm going to go ahead and hold off on answering that until we get to that section. But there's a good video that kind of covers that. All right, next slide. So feasibility and adaptions. There are going to be some groups that it's going to be difficult to wear masks. For example, people who are deaf or hard of hearing, or people who are working with students who are deaf or hard of hearing. And if those students need to read lips, that might be a scenario where the teacher would wear a face shield. Some intellectual, developmental, and mental health conditions or sensory disorders also might be make it more challenging to wear a cloth face covering. Could be a scenario where a face shield could be allowed. Or again, you can always accommodate a student with online learning. And then younger students, so younger than age 2, actually between 2 and 5, it's a little bit kind of a case by case depending on the kid. But under age 2, of course, we don't recommend masks. And then people who are engaged in high intensity activities like running would be another time where mask use would be difficult. Next slide. So steps to take if a student will not wear a face covering. So of course you need to do everything you can to get them to wear the face covering. If they absolutely just refuse, the appropriate response would be online learning for that student. The adaptation could be a face shield if that's refused. There's no adaptation that says you can just not wear a mask. That's not going to be something that's acceptable. So online learning would need to be offered to those students. All right, next slide. Just some tips to get kids to wear masks, and you guys are all teachers, so you probably could write this up yourselves. But basically, just when working with young kids, especially explaining it, not necessarily assuming that they understand what's going on or know why they have to wear a mask or even why all the things that have been going on have been going on. So really explaining it, giving them a choice, making the masks fun, letting them pick out fabrics, letting them decorate the masks. Definitely practice with them putting masks on and taking them off correctly and in ways that they're not going to contaminate kind of themselves. Being a role model, of course, so wearing a mask yourself. And again, just making them as fun as you can. This might be a good thing to, or something like this would be good to send home with parents and getting parents working with their kids at home to kind of get used to the idea. I can tell you that NASAL school started last week, and what they've reported to us at this point is that they've actually had very few problems with student mask compliance. I think more of their problems have been on the adult mask compliance side, but the kids have actually been pretty compliant with this. So hopefully that holds true for you guys as well. All right, next slide. So this next section is on screening and symptom checks. This is an extremely important component. Screening has to happen every single day, either via parent attestation in the morning or on site for any student who doesn't come with their parent attestation. And Amy, I'm going to let you jump in. Did you get the Qualtrics app? Is that something you're planning to use?
Yes.
Okay, so that'll be an app that parents can actually do their attestation. Basically what it is an adult has to screen students every single day to ensure that they don't have any COVID symptoms or are living with anyone with any COVID symptoms or confirmed COVID. So go ahead and go to the next slide, Stephanie. So, and basically if they do come to school, somehow they get through and they get to school with COVID symptom, they need to be isolated and sent home. In addition to students being screened every day, staff also need to be screened. Staff can actually do their own attestation, just sign in on a form, kind of attesting that they don't have any of those symptoms. They don't need to be physically screened by somebody else. In addition to the screening, the screening is going to include asking students and staff about symptoms, but also doing a temperature check. So any temperature over 100.4 would exclude a student or a staff member on that day. So the next slide, this is just an example of the screening questions. So basically, again, asking, do you have any of the symptoms? Does anyone in your household have any of these symptoms? Has the student been in close contact with anyone with suspected or confirmed COVID? If they have, they actually should be on quarantine likely through the health department. Has your student had any medication to reduce a fever before coming to school? So if you say, no, I don't have a fever, but it's because you took Tylenol this morning, that would not count as being fever-free. You need to be fever-free without medication. All right, so next slide. Stephanie, do you want to kind of explain this slide? This is kind of a flow chart that came out through ESD, kind of helps you determine what to do depending on different scenarios.
Yeah. So the biggest thing here, it kind of walks us through all the possible scenarios when we're looking at screening kids. The big, easy to go. There's no symptoms being displayed. They haven't been told they had COVID and they haven't been identified as a close contact. That is, hey, good, go to school. However, if they have been part of a close contact and are being put into quarantine by public health, they will not be going to school for that 14-day period of quarantine. We have had positive cases start showing, or cases rather, that have been symptom-free until day 14. And so again, that's really important that the full 14 days are maintained as a close contact because we have to see how that might develop. The third column here really talks to, they don't have this asymptomatic piece, right? We know 40% of people are more than likely asymptomatic or have very small, something unnoticeable potentially to them, really thinking they might be sick or have COVID. However, if they end up getting a positive test, and a lot of it comes out of this close contact, that's how that usually happens, they can also not go to school. And so what happens is they're put on quarantine, or sorry, they'll be isolated after 10 days is when their symptom onset is when they'll be able to return to school. This next column, they have a symptom, so their symptoms are showing. They test negative for COVID. We know other influenza-like illnesses circulate, colds, those types of things. And so the guidance has been that they can come back to school after 24 hours, have resolved their fever resolution without any medication, and their symptoms have improved. However, if they were, again, identified as a close contact, they're still in that 14-day quarantine. And then lastly, symptoms, they're testing positive, or they just haven't gotten tested, so we cannot rule them out. They are going to be basically not in school for at least 10 days. And then again, they have that idea of, it has to wait for 24 hours for their fever to resolve, and then the other symptoms have improved before they'll return to school. So this is a really handy chart to have at your home, at your office, wherever it might be, to kind of work through so you know what's happening with each individual student potentially falling in these categories. Hopefully, again, most will be in this no symptoms, they haven't had a COVID diagnosis, and they, again, have not been identified as a close contact. But it does start getting a little bit more complicated with days in quarantine and those requirements based on these others. So this chart also includes the COVID symptoms that are currently being recognized as COVID symptoms, as well as that definition of close contact, usually close, you're within 6 feet of someone for more than 15 minutes.
And this would apply to teachers as well and to other staff. So same kind of screening outcomes for teachers, but depending on the different symptoms and scenarios. I'm going to take a second to answer some questions here. So based on the video, how safe is it to stay in a classroom for several hours after students are unmasked for eating? What if they cough or sneeze while unmasked? What are your guidelines or recommendations? So first of all, we wouldn't recommend that students take their masks off for the entire 30-minute period. They really should only have their masks off when they're actively eating, which is just something that you got to do, right? Because you can't eat with a mask on. But we really don't think that the students should, they need to put their mask back on as soon as they're done eating, or if they're taking a break from eating. So hopefully we can kind of minimize that risk a little bit there. As weather allows, we really do recommend outdoors as much as possible. Trying to think of the layout of your schools. I don't know if that's something you guys can do, but having outdoors for this sort of thing would definitely be a recommendation for us if you can eat outdoors even. Let's see. The other thing just in general is these strategies, the mitigation strategies, so mask wearing, physical distancing, hand washing, all of this, you really need to think of them as sort of like layers of multiple things that we can do that when all added up together are going to significantly reduce our risk. No one strategy is going to be the silver bullet in reducing risk, but if you wear masks and you physical distance and you wash hands and you have good ventilation, all those things added up together are going to greatly reduce the risk. So it's important that we do all of the things. It does not mean that there will be absolutely no risk. There's no way to completely eliminate the risk. But we would recommend, doing all of those things, and your risk should be fairly significantly reduced by doing that. So next question, how safe is it to be in a classroom even with social distancing for more than 15 minutes? Doesn't that go against what we've been told? And yeah, kind of in that same vein about layering those strategies, what we can tell you is when we're doing a contact investigation, we look at if a person has been within 15 minutes, has been with another person for at least 15 minutes within 6 feet. We also look at things like, were they both wearing masks? Because if they were, they might not necessarily fall into that close contact. So there's other sort of factors that go into that. Within 6 feet for over 15 minutes, if you're maskless, then you would definitely be that close contact. But if you're putting some of those other mitigation strategies in place, then you may or may not kind of be considered a close contact depending on the situation. So it is really important that we're maintaining that distancing at all times, and having our classroom set up in a way so that we're not kind of on top of each other and that there is that 6 foot radius around desks. So why is it safe for kids to be, okay, I already did that one. Is that 15 consecutive minutes? Technically, no, it's a cumulative 15 minutes over the course of a day. So again, that's why it's important that we try to not be within 6 feet of each other. What I will tell you, and we're going to watch a video in a minute about the droplets, there's sort of the big droplets that those do fall within 6 feet, and they fall fairly quickly down to the floor if a person sneezes or coughs or whatever. There's the micro droplets. Those are the ones that linger in the air a little bit longer and can kind of stay in a room. And those are going to be addressed a little bit more by ventilation. And my understanding is the school district has a ventilation system that circulates fresh air in and has sort of been, Amy, you can talk more, but sort of updated to kind of address this to some extent. And this will make a lot more sense once we watch the video. But Amy, do you want to jump in on that ventilation piece?
Well, Chris Patan is here. He's probably better at that than I am because he's the expert. Chris?
Thanks, Amy. Yes, we actually have good ventilation systems in 3 of our 4 schools. Our high school is the only one that did not have an updated system to begin with. We have updated that since all of this. So we do have adequate ventilation now in the high school, but we have superior systems in all 3 of the other schools. And I've actually reprogrammed them to where we're actually pulling greater air out of the classrooms than we were before. Just to keep that ventilation, keep the air moving up so that when doors or windows or whatnot do get open, that we don't have as great of a cross breeze, which is what we all know causes a lot more of that issue and concern.
Yes, it's all about bringing fresh air in and pulling the bad air out. So whether you do that through your ventilation system or windows or fans, just kind of being conscientious of that and setting your classroom up in a way that is sort of aware of that ventilation, it does make a difference. Stephanie, do you want to answer the question about, it says after symptoms are gone. Oh, more comments. Okay, after symptoms have improved or completely gone.
It's improvement. Again, we know that this is all based off of an infectious period. We also know people have residual symptoms for extended period of time with this disease. Some of them are known as long haulers, weeks and months after their actual diagnosis are still experiencing some of these symptoms. So again, it's really more focused on the infectious period, and that's what these timelines are based on.
Great. And then the table on the county website looks like not current data. So the county website data is based on the state system, and it does lag about 3 days. So it should be current up to about 3 days or so. If you ever want the up to the minute, like today's data, you can contact us at the health department. We have the up to the minute data. For example, I think the couple cases that popped on our caseload yesterday, they probably are not reflected on the state's website and won't be until probably at least tomorrow or the next day. We do send out a updated data trend chart to the superintendents each week on Monday. So that's something that's available. But again, give us a call if you ever want to know the up to the minute. Otherwise, you can know that state data, which is what populates our data dashboard, that is about 3 days lag behind.
Yeah, I'm going to take everybody through a little bit of tutorial because I find this is a question a lot. So if you go to, again, the pacificcountycovid19.com website where our resources and things are posted, we have 2 dashboards. This first one is that county data dashboard. Again, the lag here is, from September 23rd. They've also been having, sometimes this is all DOH supported. And so sometimes there's bigger things happening at the large data collection levels within our disease tracking stuff, and even the fires impacted servers. So always make sure you're looking at that date at the top. This first dashboard should have it's usually pretty good. I try to make sure I'm looking at that. Most of the time, the biggest thing people are a little bit here, we're trying to work out why this is still showing such a lag of almost a month. But if you go to the actual disease activity, and this is where I direct most people, you can see that case rate. There's what they call the complete data set and an incomplete data set. Our incomplete data set, so you can see that that's good up and through the 23rd, is actually really close to spot on. In larger counties and with a lot more caseload, it takes a lot more time to sometimes get all this into the information systems that are required, but we have been really good at being able to get ours in quickly, and it gets updated within the whole tracking system. So while the complete might be all the way back to the 13th. For, I would say, 99% of the time, if you are also going off of the incomplete data set, you're going to get a good number for that case rate data. Again, we also we have a weekly forum that's gone bi-weekly now where we do a data update. And that data update will also happen every week, regardless if we have the community forum, so you can get the latest and the greatest. But you can always give a call at the EOC and we can get you, again, where we stand, because it does change through the day for sure.
Thanks, Stephanie, for that. Okay. So if you were a teacher, would you be completely confident that these measures make this return to the classroom a safe and viable solution?
Should actually say no.
I'm sorry?
So I want to start with kind of some basic components, right? When we look at COVID, for the last 6 months, we've been in an emergency response with different people, different levels of risk and exposure. What we know when we look at modeling and when we see things, these different, what we call non-pharmaceutical interventions, wearing of masks, distancing, washing hands, the screening to keep people that are sick out of the schools is what really decreases that risk. We right now, again, in our community risk level we're in the low risk. I'm feeling comfortable with that. When we were in the high risk, I was not feeling comfortable with that. And I think that that's what is important. And that's the data that's going to drive the County Department of Health's recommendation that is acted then on the school board. So just realize that we are intricately with every case investigation, every contact tracing within our data, and making sure that those cases are correct, making sure that we're getting the context that we can get. And again, we've been very successful. I am extremely confident in what my public health nurses are doing, especially with what we have. As soon as we get any inkling of any sort of COVID activity somewhere, they are figuring out where, why, and how. And so again, like I said, with our latest case data keeping us in moderate or low, and with all of these interventions and again, layered interventions put in place, I think it's a very effective way to create an environment that is safe for not only staff and students, but again, the community at large, realizing we're all connected in this. So it's not just where is the risk, it's risk from everyone, and everyone's job also to help us keep those numbers low, not just in our work environments, but what we're doing in our personal time as well.
All right, thanks, Stephanie. And yeah, it would be great if we could, have a 0% risk. And I don't think that's ever going to happen. But I do agree with Stephanie that given the circumstance we're in right now, and assuming really good compliance with all these safety requirements, I do think it's probably an okay thing to kind of start out, especially on a reduced basis, like I think all of the schools are considering doing in Pacific County. And again, I think our county actually probably does a better job than most on that contact tracing, which really makes a big difference. We have very experienced public health nurses who do a really good job with that. And we haven't had to defer to the state or anything like that, which I think can cause some lags and delays. We've had enough capacity so far locally to handle all of the cases. Hopefully it stays that way. All right. Excuse me. So how often is the air exchange between, I'm going to let your ventilation guy answer that question. I'm sorry, I can't remember his name. Chris?
He did in the chat, so.
Okay, perfect. So in terms of the windows, it's kind of having your windows open or having a ventilation system that's specifically designed in such a way to bring the fresh air in or out. You don't necessarily need to do both. So if you're, in a building where you have that kind of ventilation system, that should be adequate. If you're not in a building that has that ability, with the ventilation system, then we would definitely recommend windows being opened. Let's see. Can we use air purifiers? We would recommend that if you have air purifiers. Air purifiers are going to they're going to help. It would be another one of those layers, in terms of the mitigation. It's not going to prevent anything 100%, but it could definitely help. So if you have an air purifier, that would be a good idea. Let's see, our classrooms get hot. I don't know. I kind of feel like I'm going to maybe leave some of these ventilation questions to maybe you guys can handle these after the meeting, because we don't have the expertise on your guys' ventilation system. Is that okay, Amy and Chris? I'm going to address these questions.
Chris has been answering most of them in the chat, so I think we're okay.
Okay, great. So we'll move on. Hygiene practices. Go ahead. Next slide. So big important point on hygiene practices. The most important thing is stay home if you're sick, and hopefully kids are staying home if they're sick. And if someone does happen to get to school and they are sick, or they become sick while at school, they need to go home. It's super important. Probably the number one strategy to really reduce risk is just avoid the symptomatic people from being at school. Second, and also very important, is washing our hands a lot. Wash our hands before school, after, morning recess, after lunch, before lunch, washing our hands all the time. And we're really working with kids to learn how to wash their hands correctly. It's not necessarily a skill that all students have. And you guys all know they're little germ factories, and we don't want unnecessary spreading of any of those germs. Teaching kids not to touch their face and their eyes, because that's another thing. You can pick it up on your hands, touch your face. That's a way you can spread COVID. Not as likely as the airborne, but it is a possible way to spread COVID. Let's see. And then also teaching kids to cover their cough into their elbow or into a tissue, not coughing into their bare hands, that kind of a thing. Washing your hands after you cough or sneeze. Next slide. So I think this is stuff that people tend to know, but I think the biggest thing with hand washing that we miss is that people tend to not do it long enough. Go to the next slide, Stephanie. There's many iterations of this. This one is a Bohemian Rhapsody lyric, but you can put, print these out, laminate them, put them behind the sinks. If you sing this much of Bohemian Rhapsody in your head while you're washing your hands, that's about the equivalent of 20 seconds. 20 seconds is what we want with hand washing, and it's a lot longer than it seems. So just kind of a funny way to make sure that you're actually washing your hands for long enough, because you really need to be getting wet soap between the fingers and doing it for at least 20 seconds. All right, physical distancing. This is that video that I had talked about the micro droplets. Also kind of reiterates why the ventilation is important. So Stephanie's going to get that queued up and we will watch that video.
About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the micro droplets, shown in red, continue to drift. This simulation uses only micro droplets. 5 minutes later, 10 minutes later, 20 minutes later, the micro droplets are still floating in place. But there is a way to prevent this stagnation of micro droplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, micro droplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。
Okay, so again, kind of showing the importance of that ventilation, having good fresh air coming in, bad air going out. Also the importance of masks. Those demonstrations were shown on maskless people. So a mask would actually stop a lot of that from ever getting out. It would contain it within the mask. So another important demonstration on why masks are important. Do a couple of questions here. If you get sick, if we get sick, do you have to test for COVID before we come back to work? And I don't believe so, but you do need to wait at least 24 hours after you don't have a fever and your symptoms are better. Correct, Stephanie? You're muted.
If you have a symptom that is associated with that list of symptoms, we do recommend testing, particularly if you feel like you've been in any sort of exposure type of environment, right? The biggest thing is if you get tested and you have that symptom, we should be able to identify if you're negative or positive, and then that will follow that on. Now, if you come back negative as a test, then again, it's that 24 hours without a fever and your symptoms are improving. Again, but if you come back positive, then it's that 10 days past that initial system and you're pushed and pulled into our public health nurse and will be tracked in isolation. So again, symptom, if it's something outside a normal allergy, like you're like, oh, these are my allergies or whatever, or a normal condition, you have a shortness of breath because of some sort of underlying health condition. Again, anything that is one of those symptoms, we do recommend testing.
Thanks, Stephanie. And yes, I don't disagree now that you've pointed that out about Bohemian Rhapsody. There are many, many, many examples of the song. So you could find those on the internet, or looks like Happy Birthday Twice also gets you to 20 seconds. So good tip. Let's see, students will be seated 6 feet apart, but what about support staff who will spend the bulk of our time walking between them. I think the key is that you don't want to be seated next to and stationarily next to somebody for a good amount of time. You should do what you can to have your support staff also be socially distanced anytime they actually can be. We understand there's some times where you won't be able to do that, but it's really about limiting the amount of time where you're really parked next to another person. If we do get sick, have a fever, can we work remotely? So this is going to need to be a question you address with your administration. Amy, I imagine you guys can address that later, or if you want to talk about it now.
Later. Yeah.
Okay.
It depends on how sick they are and some other factors.
Okay. All right. So just here's a kind of a just a visual to show how effective the intervention is. So this is physical distancing. What they found is when physical distancing is happening, there's about a 2.6% risk of infection. When it's not happening, it's about a 12.8% risk. So you can see it's pretty significant. Again, not zero. We're not eliminating risk, but we're greatly reducing risk. Go ahead and go to the next slide.
One sec there. I think did we answer the one about kids sneezing on their mask?
Oh, I'm sorry.
That's okay.
One? Okay.
Do kids keep their mask on when they sneeze? Yes. So we were directed, same kind of habit. Your mask is on and into the elbow. No need to touch the elbow, but again, to keep up that habit. So eventually when we get out of mask wearing, that habit is still there. If it does get gross, obviously changing out the mask, changing out your mask, washing your hands prior to and after that happens is extremely important as well.
Great, thank you. All right, next slide.
Oops, sorry, did I go too many?
Okay, so this is, here we go. This is just the policy regarding physical distancing. So again, increasing space between desks. The amount of students in a classroom is really going to depend on the square footage of the classroom. So you have to maintain that 6-foot radius. We are recommending that you cancel field trips, assemblies, any large gatherings, choir presentations, school-wide parent meetings, anything like that really should be postponed or canceled or done remotely via Zoom. Suspending or making significant modifications to anything that's considered high risk or anything that would require students to remove masks. Here's an example with PE. We understand it's hard to wear a mask if you're running. So we would recommend that you don't have running in PE, that you do things where maybe that are a little bit lower impact, where students can still wear those masks. So really looking at that curriculum and identifying activities that are going to work within the constraints, the mask wearing constraints. Also looking at staggering dismissal times in the hallways. I don't think this probably applies as much to elementary, but at the middle high school, having staggered, passing periods. Also staggering arrival and dismissal times as you can. Morning drop off, afternoon, things like that, to avoid, again, large crowds. That's what we're trying to limit, is the total number of people that we're interacting with throughout the day. Next slide. Another important thing is in your health office is really reducing congestion in the health office, having one room or area for kids with symptoms who might be sick, and then another area for kids who might just need a Band-Aid and who aren't sick. So we're not cross-contaminating those two potential populations. Hopefully you guys have the facilities to make something like that happen. Limiting non-essential visitors. So classroom volunteers, I know they're great and amazing, but that's something that needs to be limited this year. I don't know how much of this you do, but cross-school transfer, like with other districts, you don't do much of that. So also just teaching your staff, your students, your parents, your visitors, teaching, educating, making sure that you're really reminding people to stay distanced. You can have like those dots on the floor, like outside of your office, so that you're not having congestion in the office. Having, direction arrows like in the hallway, so that one route goes on this side, the other route comes back the other way, so we're not intermingling. So thinking about actual visuals and education tools to really drive home that social distancing piece. And then as you can, and I get it, the weather's awful today, and I know where we live, but as you can, doing stuff outside is going to be much, much better than inside. So anytime you take your kids out to go do whatever outside, we would highly recommend that. All right, meals. This one's a little kind of short. This one varies school to school. Are you guys going to be doing meals in the classes, Amy, or are you doing lunchrooms?
Meals in the classroom to avoid cohorts mixing.
Yeah, and that's we would approve of that strategy for sure. Again, we're trying to reduce the number of the amount of mixing between students.
And
it is
obviously
important.
they can go outside if the weather permits.
Okay, perfect. So really paying special attention to hand washing before and after meals. Meals should be plated up by adults. There should not be students touching utensils, to plate up their own. So things like salad bars would be out. Let's see, having your tables spaced, having the social distancing with the tables. Again, students need to wear the mask unless they're actively eating. Let's see, brown bag is a good idea, because it kind of limits the amount of interaction and touching between. So that would be another strategy for meals, or just individually plated meals is what we'd recommend. All right, next. Transportation and drop off. So thinking about buses in particular, the district should be looking at strategies to kind of cohort students on buses as well. It might even be that your students are cohorted by they're in the classroom. It might be kids who live in the same neighborhood, or I'm not exactly sure how you do it, but you think about cohorting across all things with the school. So their time in the classroom, their time on the bus. When they're actually on the bus, students should either be sitting with classmates or family members. They shouldn't be mixing on the bus. So either brother, sister, or a student that they're going to be intermixing with during the day anyway. So that's what we'd recommend. If space allows, having space between the kids, so an empty seat, between kids as space allows. Wanting to make sure we're doing a lot of sanitizing of like the backs of the seats, the handlebar, other high touch surfaces that the kids are going to be, touching while they're on the bus. Having windows open in the bus is really good to kind of have that airflow going. I'm assuming your buses don't have the fancy ventilation systems that the buildings have. So windows open as able. Wearing masks, it's still going to be required that the students and staff wear masks while on the bus. And the district could definitely consider reconsider bus routes to ensure the furthest pickups and drop-offs have the fewest students on them. Also definitely encouraging anytime a student can be pick up and drop off versus riding the bus or walking to school. If they live close enough, those would be other strategies we'd encourage. All right, cleaning and disinfecting. Wanted to show you guys, we get this question a lot. How long does COVID live on different surfaces? So this is a study that was published in the New England Journal of Medicine. If you're interested in the full study, you can click on the link down there below, but just wanted to show the different surfaces. The primary way that we know that COVID spreads is through the air, and COVID can live in the air for up to 3 hours. The longer the time period that goes by for any of these surfaces, the less concentrated the COVID's going to be. But these timelines are showing kind of, the maximum amount of time that something's going to live, even if it's a little bit weaker than when it first, comes out. So air is about 3 hours, copper 4 hours, cardboard and other kind of porous surfaces like that are 24 hours. The ones that you want to be a little bit more careful with are those smooth, flat surfaces like plastic or stainless steel. They found that COVID can live 2 to 3 days on those surfaces. So I want to be extra careful there. And it is possible, although less likely, that you can pick it up by touching a surface that someone sneezed on and then touching your face. So again, hand washing is very important.
Katie, can you address this a little bit more? This is the elementary group, and little kids, pencils, crayons, balls at recess. I mean, we've got a lot of touch surfaces for these guys. Do you have recommendations?
Yeah, as much as possible. I mean, I would encourage you to have kids have their own pens, pencils, crayons, markers, scissors. I would not allow sharing. I don't know if that's possible, but it's not going to be a good thing to have kids sharing those kind of utensils. In terms of PE equipment, it needs to be sanitized between uses. So there needs to be some sort of a PE monitor who's, wiping down the basketball between, uses, things like that.
And hand washing. Hand washing is always the best way to, again, ensure that that you're not transferring. Again, and those really high touch surfaces, they just need a little more extra care than maybe that daily wipe down, maybe that like twice in the morning, twice in the afternoon, you know, making that schedule a little bit more frequently for things that are touched more frequently.
Okay, I'll stop for a couple questions here. Can you, no PE, homework subs, okay. Is in the air for 3 hours. So after kids eat, it will still be in the air 3 hours after. Potentially, although again, if you're minimizing the amount of time where they're actually eating, I mean, where they're without the mask and limiting it just to when they're taking bites, you're going to really reduce that risk. Again, you can't get it down to 0, but you can get it drastically reduced. Making sure that they are putting those masks back on as soon as they're done. So let's see, can you share the link in the chat for the study about how long? Yeah, can you grab that out of the presentation, Stephanie? And actually the next slide is going to show a little bit more on that study for people who are really into the science side of this. Okay, are subs going to need to have time break between buildings or shorter term exposures in rooms that have limited exposure? Not quite sure.
I'll think on that one. What they're worried about is, you know, if we have a sub, they could be in multiple buildings over a period of days and exposed to more cohorts.
Yeah.
We're hoping we don't need very many subs, or if we do, that they can be in a building for longer, but we will work with us on this one.
At least minimizing, you know, maybe subs between buildings, you know, that could be, might get a little tricky. Okay, if we are washing the plastic items in a dishwasher, is that enough? Yes, and we're going to talk about cleaning here in a minute in a lot more detail. It's actually not that difficult to kill. Most household cleaners and typical cleaning strategies are going to work on killing COVID, but you just need to make sure you're actually doing it. All right, and then library books. So I'm going to let Amy answer that in a minute, but let's finish up with this study here. This is just showing how strong kind of the concentration of COVID is over time. Of course, when you first say sneeze on an item, it's going to be more concentrated and there's going to be more virus. It's going to be more likely that someone, if they immediately touch it right after I sneeze on it, that they might pick it up from me. If it's been 3 hours, there's still going to be some, but it'll be less likely. It becomes less virulent over time. So, you know, some of the virus actually dies. So this just kind of shows that. And again, if you really want to get into it, the link there is going to give you the whole study on that. But we just wanted to give you some basic information because a lot of people ask about how long does it live on surfaces. So
yeah, and
that was a good.
Really re-emphasize the respiratory spread is really where spread happens. This is a really small amount from surface contact. I had a microbiologist out of Rutgers. He presented on kind of this surface idea, and he really talked about how much someone would have to sneeze 100 times in that same spot for it to be virulent enough for it to transfer and infect someone. So when we look at where is priority of effort putting on mask is going to be a much bigger priority of effort than doing deep cleans and sanitizing, depending on what your resources are. So again, very small potential possible, yes, but really where is most of the transmission? It's airborne, it's within that respiratory piece.
All right, thanks, Stephanie. All right, let's go to the next slide. Okay, so this is just that how to clean and disinfect. It's actually not that complicated. The main thing that people need to do is they need to read the bottle of the disinfectant that they're using. Most household cleaners that you find at Sid's supermarket are going to be effective at killing COVID. However, a lot of people will take a household cleaner, they'll spray it on the surface and they'll wipe it off right away. But if you actually read the directions say, spray it on the surface, let it sit for a minute, let it sit for 30 seconds. It actually has a direction and it's not going to kill the virus unless you're following the direction. So just make sure that you're actually using the disinfectants and cleaners correctly. Most disinfectants and cleaners will say what it kills down on the bottom, but you know, the ones kills 99% of household germs and bacteria, those are going to work. Also, bleach and water solution is effective. It's just, again, making sure that you're doing it correctly. You're actually following the directions. In terms of specific cleaning strategies, again, we want to be cleaning high touch surfaces. That's going to be really important. So thinking about door handles, you know, maybe in the bathroom, some of the, like the flusher handle, or, you know, maybe the desk area of the teacher, the office, you know, the counter at the office. Think about like, where do people touch a lot? That's what you want to pay special attention to. When you are cleaning, it is a good idea to use, you know, gloves, potentially eye protection, wear your mask just to protect yourself. You know, some cleaners can have some chemicals in them that aren't necessarily great to be inhaling. We don't recommend the use of fogging or fumigation systems. There is a list if you're real interested in cleaning agents that are registered for use against coronavirus. We'll send you guys, or we can send Amy this presentation if she wants to share it, for people who want to be able to click on those links. Next slide. Oops. So these are some surfaces that you definitely want to be thinking about cleaning more often. Keyboards and electronics. Follow the recommendations of the manufacturers for whatever you're cleaning. Athletic equipment, again, we want those things cleaned between users. The buses, we've already talked about that. Playgrounds, you know, depends on what you're actually cleaning, but again, follow the recommendations for the type of material that you're cleaning. We do recommend some additional cleaning out on playground equipment and things like that, where there could be potential contamination. Next slide. Laundry items. If you are cleaning and it's a confirmed case of COVID and you're cleaning up after somebody, you want to make sure you're wearing PPE while you're doing that laundry. You don't want to shake out laundry because it could aerosolize something that might be living in there. If you're just doing standard laundry, you know, similar safety practices are important. Wear gloves, wear your mask, don't shake. In terms of the actual cleaning, you know, launder things on hot, use bleach if you can, but generally speaking, a laundry cycle is going to kill the virus effectively. We talked about buses and playgrounds. So next slide. All right, I think we've already talked about ventilation quite a bit. Here's some additional links and disinfection guidance. Again, we'll send this presentation out so you guys, if you're really interested and you want to kind of dig into this deeper, it's amazing how much information's out there about disinfecting and cleaning. The CDC interim guidance for administrators of U.S. schools, that's a really helpful one, particularly for you guys, if you're interested. Okay, let's stop for a couple questions. At what temperature does COVID die?
I haven't seen any literature on that. When we look at SARS in general, usually above 130 degrees Fahrenheit or so. But again, I haven't seen anything come out on temperature killing. More on the disinfectant side is what most of the stuff's been done.
All right, and then do you have a link for research on using fogging type methods? I actually think it's more that there's a lack of research showing that it helps, and there is some research that shows it can be harmful to people because of potential for misuse. If you're doing it, you're not wearing the proper mask, it can irritate your lungs and potentially be dangerous for the person doing the fogging. I know that for us, Dr. Kreger, our health officer, has basically said there's just not, the evidence isn't there for effectiveness. And just given that there's that potential for harm, that's why we don't recommend the foggers and fumigation. Custodial staff at each building will be responsible for disinfecting and sanitizing. Okay, great. Do children need to wear masks at recess? Yes, they should. All right, next slide. All right. I'm actually, I think, going to let Stephanie take this one on. She is, like I mentioned, our lead on COVID and would be somebody who would very closely be working with you if there was an outbreak at the school.
All right. So the biggest thing, right, is hopefully people are staying home if they're sick with the attestation so that it doesn't make it to your school environment. But if it does, or if somebody starts to develop and show symptoms at school, the biggest thing is you're going to isolate and then get them home as soon as possible, whether they're a student or a staff. Within that, you want to make sure that they're being put somewhere that they're not obviously exposing others. So the biggest thing we've talked about is like maybe you have normally your nurse's office is where the sick kid could go. You want to make that different than say say someone that's coming to get a Band-Aid or something like that, really have like kind of a COVID specific area that is going to be able to be available as someone shows symptoms. Hopefully a staff member can just go home, but understanding sometimes it takes a bit for a student to get picked up. During that time, definitely wearing of mask, again, is important. And then really helping to make sure that that area gets dried out or aired out, or if the ventilation is working through, and disinfecting. So what really could happen there is, depending on what happens with their testing, that's the next steps. Symptoms are shown, testing is recommended. If they do come back as a negative test, this is the requirement of you're returning to school 24 hours after that fever has resolved without medication and the symptoms have improved. However, again, if they were a close contact, that looks different, and it's a 14-day timeline. If they are symptomatic and then they end up being positive, they will be part of public health case investigation, and then we'll work it from there. But they themselves will be, again, not able to return to school for at least a 10-day period, and their fever had to have resolved and their symptoms have had to improve. The biggest thing, hold on, is really working our communications plan with the district. This more than likely, public health should know about a positive case before potentially the district. That is really what the action we work on. We don't work on hearsay. We don't work on gossip. We literally work on, we need that positive test result, or what is now a probable test result. And that availability right now is up at the Willapa Harbor Hospital. Is there the rapid test is available same day there. I'll go over some of the testing options here in a minute, but realizing that that's the actionable item for public health is when we get probable or a confirmed case. We will communicate with the school and let them know that there's been a staff or a student positive, however that's going to look. And then that's where we really start working all the contact tracing pieces within the school. And so you can see here this list of kind of requirements, understanding what classes the student or the staff member might be in, understanding if they're on a bus route, understanding their lunchroom exposure. You can see how the importance of really limiting these cohorts can really impact the amount of close contacts that come out of this investigation. And that's really the biggest thing, is as soon as someone is identified as a close contact, that 14-day is put into place. And that's where it might trip into potentially classroom closure, school closure, because of just how many people might have to be put into that 14-day quarantine component. So this is a single one. This is if there's more than 2 cases that are non-household associated. Same kind of idea as the communication flow of us interacting with the school and then best deciding all that close contact information, and then deciding again where that closure will look if there is a closure. And more than likely, it really is just going to depend. If we get a positive case of a student who hadn't been at school since, 7 days ago, it's, again, they are a student of that school, but that has been really limited exposure, right, for the school environment. And so it's different than if it's been someone that was literally there at school yesterday and is now testing positive the next day. So variability there for sure. What would happen is obviously, right, coordinating with us here at Public Health. And we've kind of already set that up, since we've been working with schools since the beginning of June, knowing who we're contacting and who we're working with. The school will communicate with the staff, parents, and students. So that's kind of that, again, mutual relationship of we are getting the information and we're letting that be known. Understanding there is a HIPAA component to this, right? We will not say what student, what staff member, we just say there is a positive case that has been identified. And then we will work with that, basically our COVID liaison, to really determine who those close contacts are going to be. Most of the time, and again, this varies because with kids versus adults, we get their movements, their understanding, and that's going to be very different potentially within an elementary school child, kind of getting those all together. So the best that we'll do is gather that information as it's available and what we need. We talked about, there might be a temporary closure for a 2 to 5 day period to allow for testing to happen and really see how widespread a potential outbreak might be. And that might continue on into a larger, going back to a remote status than being able to be in person. And then the cleaning and disinfection that will happen in the school environment based on that. So that's kind of, it's fluid. There's some definitely, press points of information that we'll work through, but every case is different. I mean, we've been doing this for over 6 months and every case works differently. And adding in the school component to that, it's going to look different. And again, we just work with what we get and how we get that information. Returning to school. Oh, sorry.
Yeah, I just wanted to emphasize what you would see with a potential case is just how important that limiting of close contacts is. When we get a case and the case has, well, my wife and maybe like my neighbor are the only people I've been in close contact with, it is so much easier for us in terms of contact tracing, and also just the risk is so much less than when we have somebody who, well, I went to a party on Saturday and there was a bunch of people there. And then I was at work and I wasn't wearing my mask. And you can see it just really becomes a nightmare. And limiting those close contacts is it's so important. So when we're talking about all of these strategies, it's not just kind of to be fun killers. It really does make a difference in terms of spread, and also the burden on public health to help to manage an outbreak and limit the outbreak. When it's contained, it's so much easier. So that's just kind of an important just thing to kind of connect those dots, I think.
And then returning back to school, again, you'll see this chart in multiple places because I think it is a very useful tool. You kind of know what's happening based on the criteria you're given, because it does look different. That close contact identity really does change when people have to stay at home and have to be remote. And so again, it's really work, and we kind of walk through this. I'm not going to go through it again, but if you have questions on this, by all means, you can ask. My public health nurse, we have that duty phone is available. It was on an earlier slide. We get calls all the time and that's the best thing. If you don't know the answer or you have a question about it, call a public health nurse and we can walk you through like, well, what does that look like or whatever type of thing. And the biggest thing here is just those timelines really do depend on symptoms improvement as well as identified as a close contact or not to a case that's already been identified. So testing, the biggest thing here is have a plan before you need it, right? Be prepared. This does kind of change, but if you have a general idea, first, if you're an Ocean Beach established patient, you can get tested through that mechanism. And that's where we really do try to say, get tested with your health provider because it might not be COVID. So if you're spending a lot of time trying to get a COVID test and then that comes back negative and you're still not feeling well, you spent a lot of time kind of wasted. So they can do that as part of their overall assessment to your health. And that's ultimately what's important, right? Is your health and how you are functioning. And so if you're not doing well and you're not feeling well, you want to make sure all the bases get covered and everything gets looked at by a health provider. So down here in South County, again, if you're a part of Ocean Beach, any of their clinics, you can call and get a test done there. Also out at the Family Health Center in Clipson. We here at the county are doing drive-throughs still on Tuesdays and Fridays. So it's another opportunity. You have to call into the call center and get screened to get an appointment. And then across the river, Clatsop does health on Monday and Wednesday. So there's options there. These are the numbers. The very least, though, you can always call the EOC, our Emergency Operations Call Center, between 8 and 4 every weekday, and we can give you the latest on testing. I did say that the place right now in county that is doing a same day test, that is only Willapa Valley, Willapa Harbor Hospital. And they are doing it between 12 and 2 on Monday through Thursday. And you just have to ride up there. It's an hour. Unfortunately, it's a bit of a distance. If you're connected with CMH, I'm not sure what the latest options are over there, but they have a COVID hotline that you can have. So really think about where you get your medical care. Is a COVID test going to be available as part of your health assessment if you end up getting sick? Very much recommended to go through that route, and then we can help you otherwise.
And just to jump in, if there were to be an outbreak at school, we do have plans in place and some ability to come and do on-site testing. So if there needed to be mass testing done, say of an entire classroom or something like that, we would likely be able to come out and actually do that on-site for you guys.
Yeah, and it just depends on what we set up. We've set up, stand-up drive-throughs and said, yep, we had a group of 30 close contacts we needed to get tested. And so we just set up a drive-through and, we can functionally do that as a public health. And that's another mechanism to get testing for sure. But if there's just singular cases of someone not feeling well, really know what your testing options are and where you can get tested. And I
Stephanie,
think-
there's a question in here.
sorry.
It says, why is symptoms with negative test 14 days quarantine and versus symptoms with positive test 10-day quarantine? I can tell you the 10-day quarantine is actually the minimum. So if you're positive for COVID, it's going to be the greater of 10 days from when you first had symptoms or your positive test, or when you start feeling better and you don't have a fever. So it actually, with a positive test, it could be longer than 10 days. 10 days is kind of that minimum. 14 days is just once you've been exposed to somebody, it's 14 days from the last date you were exposed to them. That's the incubation period. So once you're out of that 14-day period, you're out of that incubation kind of potential for actually developing COVID. So that's why it's different.
Yeah, and if you look at the chart, if it's symptoms and a negative test, it is basically that 24. I'm trying to make sure we're looking at the right thing. Symptoms and a negative test, that's where you're basically have some sort of other illness. And so we want you to have at least 24 hours without a fever and your symptoms improving. However, if you were a close contact, you're still in that 14-day holding pattern, basically in a holding period.
And go over to the right, Stephanie, because that's the situation I think he's talking about is if you
symptom and positive.
Oh, okay. I'm sorry, positive. But if you're a close contact, the one over there, it's 14 days is the quarantine because it has to do with the incubation period.
Yeah.
The bottom line, if you test positive or if you're identified as a close contact, you'll be given very specific instructions by a public health nurse, and you'll be called almost every day by a public health nurse to ensure that you're following those instructions. So it becomes very clear to those people what they need to do.
Yep. And again, it's the presentation. Again, we've had people that we continue to keep as an active case because we just like to check in on them and make sure that they don't need any other supports type of thing. We're just not comfortable with them not being monitored on a daily basis. So again, there's a lot of variety to it, but that baseline of 10 days from symptom, if you're positive, 14 days total, if you're a close contact with no symptoms, and you potentially have that incubation period.
Yep. All right. And then before we get to that, I think our last section is coming up here. Is it developmentally appropriate to expect a 5-year-old to wear a mask for a 6-hour day, maintaining distance? You know, honestly, I don't think anybody knows for sure what is going to happen. I can tell you that, again, what we heard from NACEL, which is kind of our best, they've actually gone through a couple weeks now of school. So maybe our best example locally is that they have not seen a lot of problems with the kids at this point. They said more of the compliance issues are with the adults. That's not to say that there couldn't possibly be problems, but I don't know that we have a real precedent for this. I think we're gonna have to see how it goes. Mm-hmm.
There's a couple districts up the gorge that are serving kids, and they've reported the same thing. The kids aren't the problem, it's the adults.
Yeah, so
they're just excited to be back in school, seeing their teachers and seeing their friends.
And yes, and NACEL is doing AABB. I think they're taking Wednesdays off. So they have half the kids go on Monday, Tuesday, the other half go Thursday, Friday. It's based on square footage so if you have the square footage to allow more than 2 days a week, then that's allowed. I think NACEL's got less square footage than you guys, and might be why, I'm assuming, Amy, you guys have done the square footage calculations.
The only place we can do 5 days a week is K2, and that's just because the class sizes are kept very small.
Yeah. Okay, let's move on. So this next section, this is a requirement. And Stephanie, we won't watch this video because it's extremely dry. And the next 2 slides actually just show everything that's in the video. But it is a requirement that you all are informed about what it means to be high-risk employee. So there's 2 categories. There's a group of people and conditions that do make you at a higher risk. And then there's a group of conditions that might make you at a higher risk. And this is based on the most recent research. This does change a little bit as we learn more. We change the guidance. But generally speaking, you are at a high risk at an increase for risk of severe illness from COVID if you're over age 65, if you have cancer, chronic kidney disease, COPD, if you're in an immune compromised state, obesity, and I swear to goodness I change this, but it always goes back. It actually should be BMI of 35 or higher, puts you at an increased risk. Serious heart conditions, sickle cell disease, and type 2 diabetes. Those are conditions that have been shown to put people at an increased risk for severe illness. The next slide is going to be a list of conditions that might put you at an increased risk. So here we're looking at asthma, cerebrovascular disease, cystic fibrosis, hypertension, immune compromised state from the use of immune weakening medicines, neurological conditions like dementia, liver disease, pregnancy, pulmonary fibrosis, smoking, thalassemia, and type 1 diabetes. So next slide. Basically, we just want everyone to be aware. If you are a high-risk employee, it's important to kind of know that. I'm just going to read through these. These are kind of the frequently asked questions regarding high-risk employees and what rights they might have. So we'll just go through this real quickly. Can a high-risk employee choose to come to work without additional accommodations? The answer to that is yes, but it needs to be an informed decision. So that's why we're talking about it right now. Can a high-risk employee ask for additional protections? The answer to that is yes. And the district needs to follow existing law on reasonable accommodations. So L&I has longstanding guidance regarding workers' rights, and workers are entitled to ask for reasonable accommodations. The key word there is reasonable. And a lot of this is set out by L&I. If it is something that is reasonable and the district can accommodate, the district should do that. They don't have to put in an unreasonable accommodation though. So that's important to note. Can a high-risk employee ask for alternate work assignment if additional protections cannot be provided? They definitely can ask for that. Again, you're going to follow L&I guidance on what a worker might be entitled to or not. If it's an unreasonable accommodation, that's not something that the district can't do, then there wouldn't be a requirement that the district actually accommodate that way. Number 4, if a high-risk employee cannot be provided additional protections and there are no alternative job assignments, can the employee access eligible forms of leave? So like sick leave, vacation time, things like that. And the answer is yes. Are school districts required to provide an accommodation to an employee if the employee is not high risk, but the employee lives with someone who is? And the answer to that is no. The protections for employees just apply to employees, not necessarily the people that they're living with. All right, so moving on. Is this our last slide? I think this might be it. Yep, this is the last slide. So we will open it up, I guess, just to general questions. You guys have been great and popping questions in as we go. So hopefully we answered a lot already, but maybe just give it another minute here in case there's other questions before we wrap up. Okay, so Amy, I don't know if you guys are staying on, but I think that's it for us for today. Again, we are available anytime if you guys want to give us a call and to answer any specific questions as things come up again, or to get the most recent data. We're really happy to share that with you guys and help troubleshoot specific weird situations. We get a lot of questions all week, and we do a lot of that, and we'll run it up the chain to Dr. Kreger if needed. He's very knowledgeable and helpful also. But we do want to wish you guys good luck and wish you good luck and just kind of recognize we know this is really a heavy lift, and you know, it's hard and it's not something people know how to do. So we appreciate your guys' efforts, and we hope it all goes well for you. And again, if you need support in any way, please reach out.
There is one question, Katie, about bathrooms and kids in bathrooms.
So bathrooms, you really should try to limit one student in the bathroom at a time. Stephanie, any thoughts on that? I think that's what I've heard is limit.
Yeah, I mean, it's the same thing, right? If keeping the distancing and everybody keeping their mask on and then washing hands.
Mm-hmm.
Sounds good. Thank you.
Yep. All right. And on the bathroom note, I think we'll go ahead and sign off for today. Again, Amy, this will be available on a link on YouTube. I can send it to you for any staff who might have missed if you want to share that.
Thank you very much.
All right. Thanks, everybody. Have a good rest of your day.
Hi, thank you.
All right, bye.